thank you for participating in the Wellness Way, brought to you by ACP, Southern California, Region 3 Chapter. My name is Marcus, and I'm a medical student at UCSF, and today I'm honored to interview Dr. Sharpe. Dr. Sharpe, can you be so kind as to tell us and our ACP viewers a little bit about yourself and what do you do?
Yep, it is great to be here. So I grew up in Iowa, a small town in the Midwest, but now I've been at UCSF for 22 years. So I'm internal medicine trained. So I did my internal medicine residency at UCSF, fortunate enough to be a chief resident here. And then now I'm what you would call an academic hospitalist here at UCSF. So academic in that I'm engaged in teaching and other academic things. And then I'm a hospitalist focusing on hospital medicine. And as I describe it to patients, actually, a hospitalist is we don't do surgery, we don't deliver babies, and we don't take care of kids, but we sort of take care of everything else. I live in San Francisco. I have a spouse. She's also a physician and a hospitalist. And then we have a 10-year-old daughter and a 7-year-old daughter who most days are magical, I would say.
Great. Thank you so much. I'm a little curious. How did you choose your career path in medicine?
I will go back to an anecdote that has guided me in my career. It's a little bit of how I found my path and then advice for all of you thinking about your future. So I was a first-year medical student and I thought I wanted to be a surgeon. And my advisor said, you should meet with the chief of surgery. So I meet with the chief of surgery and he said, Brad, let's take a step back. He's like, I'm going to ask you a series of questions and this is going to help guide your career. And I was like, wow, that's great. And he said, the single most important question to ask yourself is, do you want to be in academic medicine or not? And I was like, wait a minute, that's the most important question. And he said, yes, because if you're in academics, it means that not only are you taking really good care of patients, but you're also doing something else. You are doing research, you're teaching, you're doing informatics, you're doing global health, you're doing disparities, you're doing equity work, whatever it might be. While if you're in the community, your main goal is to take really good care of patients. He's like, that's the biggest decision. And I realized early on, I had many interests outside of clinical care. Question two is, he said, do you want to be a researcher or not? I was like, what does that mean? He said, well, if you're going to be a researcher, it's really what you do the most of the time, which is like 3/4, 75% of your time is research. And it's like, do you see yourself doing that? And I was like, not really, not for me. That's for other people, not for me. And then the next two were, do you see yourself in the hospital or out of the hospital? And I realized pretty quickly when I got into clerkships, I love the hospital. This was the old days where call days were like 36 hours, where you'd like show up at 6 in the morning and you'd be there till 6 p.m. the next day, often wouldn't sleep. And I actually looked forward to those days, like really look forward to them, all during medical school and residency. In the hospital, you have a lot of control, actually. Like if a patient has pulmonary edema from heart failure and you give them furosemide, you come back an hour later, they've peed a liter and they feel better. There's a certain amount of like control. You get the x-ray comes back. Like I really like that, I think, as well. And then the last question was, the surgeon asked, was, do you like procedures? And I thought I did, but then I would encourage you to reflect on your life. Are you someone who tinkers with things and fixes stuff? Or are you like me, where you're like, light bulbs are kind of a problem? Because I'm not a mechanical person at all. And that's what's like, oh, I'm not going to do a procedural specialty. So all that led me to where I am today, which is an academic hospitalist who loves the care of patients in the hospital. And then also I love teaching, and then I love sort of administration and leadership, and I'm happy to answer questions about those as well.
Thank you. That was awesome. Thank you for the anecdote. Next up, what advice do you have for rising medical students and current residents as they're figuring out their path in medicine?
Thank you, Marcus. I'll share with you a Venn diagram that was shared with me that I continue to use and use when I'm mentoring both students, residents, and faculty. So I'm going to ask you to do a mental picture in your brain of 4 overlapping circles and all in a square box. So each of those circles represent things to potentially strive for as you think about your career. So the first one is, ideally, you are charting a career path in something that you love. So picture a heart, a heart in that first circle. 2, imagine the next circle has a dollar sign, because you do actually have to get paid. You do actually need to make money. So, because if you love what you do, but you're not getting paid, that's kind of a problem for life. 3 is, imagine a gold star, which is it's something that you're good at. You excel at it. You're going to make a difference in the world. Those usually overlap. That usually overlaps with what you love. But let me give you examples of people I knew that didn't. One is my friend who does emergency medicine, where he is really good at making the schedule for his group, but he hates it. What you love to do, you'll get paid, you're good at. And the last is, will it advance your career? Part of that is like, what impact you're having on the world? How are you making the world a better place in some ways? And then all that is in a box, which is the context of your life, which is, are you raising a family? Do you have sick older parents? Do you need to move across the country? Is your spouse or partner in fellowship? And life makes life complicated sometimes. But that Venn diagram has helped me make decisions, both big decisions about career path, but also small decisions about, do I want to lead that project? Do I want to lead that thing? So those are some one framework, at least, to approach sort of charting your career path that works for you.
Thank you for talking us through that framework. Very much appreciated it. Our next question is more wellness-based. The question is, how do you generate a personalized toolkit to manage stress?
Well, first, let me acknowledge that stress is part of life. And for those training to be physicians, often part of the profession. I will share, I come to this as someone who, at 3 points in my career, I found myself burning out, or burned out, actually, in my version of burnout, which the anecdote that was most powerful was, I would go to see patients in the hospital, and I would, listen to this, I would hope their family wasn't there. This was before COVID, because I didn't want to have to spend 20 minutes to have a conversation with the family. That's when I knew, you know what, I need to take a break. And now I'm in a better place about this idea of a toolkit. So one is personalize it, because each one of you is different. Each of us is different about what gives you fulfillment. For me, fulfillment at work is teaching and also interacting with patients and learning about them and sitting at their bedside. And then outside of work, I had to figure out what gives me fulfillment. And for me, it is exercise. So I exercise almost every day and I make it a priority, but I had to learn that that was my thing, while other people, it's reading or playing the piano or going for a walk or meditation, whatever it might be. So it is to personalize it. And then two is use the evidence, make sure you sleep, make sure you eat well, exercise, whatever your capacity is. And then meditation, actually, the evidence for meditation and gratitude is pretty awesome, actually, meaning finding a way to meditate that feels comfortable for you. And then expressing gratitude. We, at the dinner table 3 or 4 times a week, we basically share something that we're grateful for. The studies show that if people do that, they are more fulfilled, less burned out, more satisfied with life. Figure out what works for you, because fulfillment can crush burnout, actually, both inside and outside the hospital. And then using the data, because it is important that you take care of yourself and don't do as I did, which is find yourself burning out, because it really does impact yourself, your family, and the care of patients, unfortunately.
Okay. Thank you, Dr. Sharpe. Thank you so much for sharing your time and knowledge with us. I know that both myself and the viewers will find this very beneficial. So thank you again.